Hello, I'm Dr. Kester Ifui. In this video, I'll be discussing ultrasound assessment of oligohydramnios. Um, I will do the conversation under the following headings: the definition of oligohydramnios, causes, the indication for ultrasound assessment of amniotic fluid adequacy, equipment required, the procedure and technique, aftercare, and then we'll discuss complications. What is oligohydramnios? Oligohydramnios refers to reduced amniotic fluid volume in pregnancy. So, why does it matter? Oligohydramnios matters because of the importance of amniotic fluid to the well-being of the baby. Let's go over it a moment. As we know, amniotic fluid is initially formed by maternal fluid seeping in from maternal plasma across the fetal membranes and skin into the amniotic cavity. But after about 16 to 20 weeks, fetal urine becomes the primary source, supplemented by lung secretions, while the fetus also swallows and reabsorbs the fluid, creating a dynamic, self-regulating system. Now, what are the functions of the amniotic fluid so created? Amniotic fluid cushions the baby from bumps and injuries, like the shock absorber of a car would do. It functions in temperature regulation. It facilitates lung and digestive system maturation as the baby breathes and swallows it. It prevents cord compression. It prevents fetal compression in severe oligohydramnios. And of course, it provides nutrients and antibodies for the growing baby. So, what can cause oligohydramnios? Lots of things. One, premature rupture of membranes. Another is uteroplacenta insufficiency. When there is poor placenta function, reduced oxygen and nutrient supply can cause reduced fluid production. Fetal renal anomalies, problems with the amniotic fluid factory in the second trimester coming from the kidneys and lungs will lead to reduced amniotic fluid production. Maternal hypertension, preeclampsia, maternal diabetes, maternal dehydration, all can predispose to oligohydramnios. When we're going past the due date for pregnancy, for the woman to deliver, amniotic fluid production is reduced. Okay, so if a woman is post term, we're very likely to encounter oligohydramnios. Multiple pregnancies also tend to have cases of oligohydramnios. The use of NSAIDs, non-steroidal anti-inflammatory drugs, can predispose a pregnancy to oligohydramnios. The use of ACE inhibitors has been shown to also cause oligohydramnios. A lot of other times, the causes of oligohydramnios may not be able to be found. In such cases, such idiosyncratic cases also abound. Now, I've added in this presentation a mnemonic which one can use to remember some of the major causes of oligohydramnios. The mnemonic is DRIP-C, where the D stands for fetal demise. Of course, when there is fetal demise, we expect oligohydramnios because of reduced amniotic fluid production. Fetal renal abnormalities, where in case of agenesis obstruction leading to decreased urine volume with respect to oligohydramnios. That's for the R, renal abnormalities. The first I in the drip mnemonic is intrauterine growth restriction. Okay, the first P is premature preterm rupture of membranes. Then post date, like we have discussed before, and then chromosomal abnormalities. So, armed with this mnemonic, we can remember some of the major causes of premature of oligohydramnios. Now, why would a sonographer, sonologist, radiologist, as the case may be, decide to have an objective assessment of the amniotic fluid volume, of how an adequate amniotic fluid is in an ongoing pregnancy? Now, this may be because of one, reduced symphysiofundal height. Reduced symphysiofundal height. When in an antenatal session, the midwife or whoever is the care provider notices that the fundal height is reduced, they may want to evaluate the amniotic fluid. Premature drainage of liquor is the second reason. When a woman complains that she's noticing water coming out of her body and we test it to be amniotic fluid, we want to know how much of the amniotic fluid is remaining. So a scan will probably need to be done. In cases of fetal growth restriction, where you have inconsistencies in the fetal biometry on ultrasound, you would want to evaluate the amniotic fluid volume. In cases of fetal anomaly in the ongoing pregnancy, or even a past history of fetal anomaly, one will want to keep an objective eye on the amniotic fluid volume. When there is maternal hypertension, maternal diabetes, multiple gestation, the amniotic fluid assessment is required. Also, we expect the amniotic fluid volume to be assessed in the routine anatomical survey done between 18 to 22 weeks. Okay, now I want to show us a few images of the amniotic fluid. This image is showing the anechoic amniotic fluid surrounding the baby. This is an image of the baby in cross section at the level of the heart. By eyeballing, one can see that there is adequate amniotic fluid. This was a routine pregnancy scan. We also note, of course, the fibroid lesion in the posterior myometrium. Here is another image also showing the anechoic amniotic fluid, and this by eyeballing looks quite adequate. It looks adequate, even bordering on being excessive. All right, another image here shows us a slide, a sonogram showing amniotic fluid collection and a placenta anteriorly. However, in this particular image, one would not be in a hurry to say that the amniotic fluid is adequate, especially if the volume noted is like this in the different quadrants of the abdomen, of the uterus. So, in a situation like this, during ultrasonography of the pregnancy, one would want to get an objective assessment. All right, here is another sonogram showing placenta anteriorly and pockets of the amniotic fluid that one cannot outrightly say is adequate by just eyeballing. In a situation like this, if this is the predominant kind of image we are getting from the different quadrants of the abdomen, one would want to objectively assess how adequate this amniotic fluid volume is. So let's talk about the equipment required to measure the amniotic fluid volume sonographically. To do this, we need an ultrasound machine, a good ultrasound machine, preferably with ability to do color Doppler imaging. Color Doppler imaging capability is not a must, but is preferred. Next, we need a curvilinear probe, right? The same curvilinear probe you use to do your routine obstetric scanning is the preferred probe for this exercise. However, other probes can be used. Your volume probe can be used. Your linear probe can be used depending on the gestational age and adequacy of the abdomen. But the ideal probe is the curvilinear probe. Now let's talk a bit about the procedure for the scan. Now, first, it's advised that you welcome your patient, introduce yourself, check the patient that the patient corresponds to the biodata or request that you have, take a brief history, invite in a chaperone, then have the patient lie down with the head of the bed inclined at 45 degrees. Expose the patient's abdomen and drip as appropriate. Of course, we do realize that in certain clinical scenarios, you may not follow this to the letter, but you should welcome your patient, make them feel comfortable, introduce yourself, and then have a chaperone present. Now, there are two methods of evaluating amniotic fluid volume. Let me at this point say that oligohydramnios is commonest in the third trimester. However, it can also happen in the first and second trimester. If it happens in the first trimester, usually the outcomes are more ominous. Okay, and then the method of estimating oligohydramnios in the first trimester is different from what we're going to discuss now. In another video, we'll talk about oligohydramnios assessment in the first trimester. Now, in the second and third trimester, we use these two methods, the maximum vertical pocket method and the amniotic fluid index method. Now, the maximum vertical pocket method is also called the single deepest pocket method. Now, to perform this, the entire uterus is scanned to find the single largest pocket of amniotic fluid. The ultrasound transducer must be held perpendicular to the floor. Now, when you've selected the largest pocket, you activate your color Doppler if it's available to be sure that there is no cord in that space, and you also make sure that there is no fetal part in that area. Then, with your caliper, you measure the largest pocket. You make a vertical measurement of it. That's anterior posterior. Now, to be considered valid, the pocket should generally be at least 1 cm wide. Now, whatever your measurement reads represents the amniotic fluid volume, and the normal is considered to be 2 to 8 cm, which means if you get any value that is between 2 and 8, that amniotic fluid volume is adequate. However, if your measurement falls below 2 cm, oligohydramnios is considered to be the situation. If the measurement is above 8 cm, then you have a case of polyhydramnios on your hands. Some centers take their normal to be 2 to 10 cm. There's a minor variation. Let's point out here at this point that measurement of the maximum vertical pocket, the single deepest pocket, is the fastest way to estimate amniotic fluid. It is also the preferred method in most cases. We'll talk more about this. Here is an image showing the procedure for amniotic fluid estimation, the single deepest pocket. On the left side of the image, we see the hand of a sonographer with the probe oriented perpendicularly, vertically above on the patient's abdomen. And on the right, we can see a sonogram demonstrating how the single deepest pocket was measured vertically with no fetal parts within the area of measurement and no cord. In this case, the measurement is about 10 cm. It's a little bit above normal. Here also is a sonogram showing the measurement of the single deepest pocket. Also, in this measurement, in this sonogram, with the measurement taken, we see there is adequate amniotic fluid. Yet another sonogram, however, in this case, the largest pocket, single deepest pocket measures 1.2 cm. This is a case of oligohydramnios. Remember, we did say that the normal range for amniotic fluid volume using this method is 2 to 8 cm. So a measurement of 1.2 cm falls short. So this is a case of oligohydramnios. Here is another sonogram showing measurement of a single deepest pocket. Now the measurement here is 10.3 cm. This is a little bit above the normal, but I brought this image to show you. If you look closely within the amniotic fluid, we'll notice some echogenic material, some form of debris. In another video, we will discuss such findings. Now, the second method for measuring amniotic fluid volume is called the amniotic fluid index method. This is a semi-quantitative method used primarily in single pregnancies at or past 24 weeks gestation. Now, to calculate the amniotic fluid index, the maternal abdomen is mentally divided into 4 quadrants using the umbilicus and the linea nigra as landmarks. Now, the ultrasound probe is held perpendicular to the floor and moved over each quadrant. In each quadrant, the largest vertical pocket of amniotic fluid that is free of umbilical cord and fetal body parts is measured. Now, color Doppler may be used to confirm the pocket is cord-free. The 4 individual vertical measurements are then added together to reach the amniotic fluid index score. Now here is an image showing a maternal abdomen divided into 4 quadrants. You shouldn't draw this line, of course, you'd make this in your head, right? So, but you scan through the 4 quadrants and acquire images like so. You acquire your measurements, deepest pocket from the 4 quadrants, and then add up the measurement. The sum of the measurements gives you the amniotic fluid index. Now, what is the normal range? Normal range is 5 to 25 cm. So what this means that if you have a measurement between 5 and 25 cm, there is adequate amniotic fluid. However, if the measurement is less than 5 centimeters, that means there is oligohydramnios. If, however, it is more than 25, it means there is polyhydramnios. In some centers, they use their normal range to be between 5 and 24. All right. Now, there are some clinical considerations that we want to highlight. First, compared to the maximum vertical pocket method, amniotic fluid index is known to more frequently categorize pregnancies as having oligohydramnios. This can lead to increased rates of labor induction and cesarean sections without necessarily improving neonatal outcomes. So currently, recommendations suggest using the maximum vertical pocket to diagnose oligohydramnios, but favor amniotic fluid index for diagnosing and managing polyhydramnios. Okay, so amniotic fluid index, the third point, is not used for multiple gestations. For multiple gestations, we would rather use maximum vertical pockets. Now you have scanned the woman. What is the aftercare? What do you do next? Inform the patient that you are done with the scan. Clean off the gel from her body. Ask her to turn to her side before getting up from the couch. Assist her in getting up from the couch. Next, discuss your findings with her if you are in a professional position to do so. If not, direct her accordingly to the relevant clinician. Let's talk about complications. What are the complications of the scan? There is no known complication of the scan to evaluate amniotic fluid in pregnancy. However, there are lots of complications associated with oligohydramnios. Oligohydramnios can lead to various maternal and fetal complications, the severity of which depends on the gestational age at diagnosis. Okay, now in early pregnancy, in the first 6 months, if there's oligohydramnios, some of the complications may include underdeveloped lungs, also known as pulmonary hypoplasia. Now, this is the most critical risk and can lead to severe respiratory distress at birth. There may also be physical deformities. Compression in the womb can cause limb contractures, facial deformities, and skeletal anomalies. There may even be pregnancy loss. There's increased risk of pregnancy loss with oligohydramnios in early pregnancy. Now, in late pregnancy, in the third trimester, some of the complications include umbilical cord compression. There may be fetal growth restriction. There may be fetal distress. And then there may be meconium aspiration. Okay. Now, there may also be maternal complications. All right. With oligohydramnios, there is increased risk of obstetric interventions, higher likelihood of labor induction, higher likelihood of cesarean section. Now, if the low fluid oligohydramnios is due to premature rupture of membranes, there is an increased risk of chorioamnionitis, which is an infection of the amniotic sac and fluid, a dangerous thing. With oligohydramnios, some studies have also shown a higher risk of hemorrhage during delivery. Now, what are the complications for the neonatal period? There's a higher chance of NICU admissions. Newborns are more likely to require intensive care due to respiratory issues, low birth weight, low APGAR scores. Perinatal mortality. Now, while most babies are born healthy with proper management, severe cases of oligohydramnios carry a higher risk of neonatal death. Now, I want to say a very big thank you to you for listening. And if you have found any value in this video, I want you to give us a thumbs up and follow our channel. Thank you.